Today we're going to be covering a specific topic in regards to a sports-related injury. We're going to cover kind of a younger athlete, their typical presentation, some of the things you may find along the way, some of the injuries that can occur in some common sports such as wrestling or football. And we kind of go over what can kind of happen and some of those injuries and how they'll present and kind of the whole progress and process of the whole situation. So what are the most common sports-related injuries? We have sprains and strains, which can be muscular or joint-related. We have something as shin splints that everyone's kind of heard of. Some of the most common knee injuries will typically be ACL, meniscus, or PCL. Some of the shoulder injuries in our, let's say, tennis players or swimming athletes will be something like a rotator cuff injury or tear. Or they could also have something as common as supraspinatus impingement, which causes kind of dysfunction and movement of the shoulder, depending on certain movement or actions and depending on the sport. Common ones are fractures and even dislocations as well. So here we kind of have a patient presentation, kind of a case I made up. It's going to be kind of a little background here, kind of give you some idea of what we're working with and what some of the similar presentations may be for a young athlete. So we have Aiden Macias, who is a 16-year-old male athlete with his primary competitive sport being wrestling. He plays contact football in... So here we have a typical patient presentation, kind of everything we're going to be going over, kind of give you a background, fake patient, some of the things you may see with a younger type of athlete, and some of the common mechanisms of injury. So here's a little bit of background. So we have Aiden Macias, who is a 16-year-old male athlete with his primary competitive sport being wrestling. He plays contact football in the summer to fall and begins his wrestling training right after the football season. He is participating in competitive sports all year round with a little bit of downtime. So he's training around 5 to 6 days a week, and 3 to 4 days out of the week he has 2 training sessions on that same day. So most of the time they'll call that 2-a-days. He's planning to wrestle in college and wants to be accepted into a D1 school that has a D1 program for wrestling. So Aiden has come into the office because he is presenting with low back pain. This pain has been going on for around 2 months and has progressively gotten much worse. So something you'll see with athletes, they'll tend to put it off, they won't get it taken care of right away, and then it tends to kind of compound and get a snowball effect, getting worse and worse and worse as time progresses. So he's unable to fully extend himself and has difficulty flexing forward. Any quick movements cause him a sharp pain in his lower back. So Aiden plays as a tight end and is interchanged with the lineman position. He wrestles at the 164 weight class, and he tends to gain weight for his football season and drops weight during his wrestling season. So we kind of see him in a surplus of caloric intake during the fall and summer for football, and then during fall and winter to even spring, he's in a deficit kind of issue. So Aiden has not seen anyone else other than his school trainer. His football coach has advised him to not see a doctor, as if he does, he may not be able to play in the upcoming games. You know, not all coaches are bad, but, you know, in some cases they will tend to push off having one of their main athletes go see someone or see a physician, as they don't want them to be out for the season. So if you are pressured in that sense, make sure you do get it taken care of and get it looked at by a professional. It could be something worse, it could be something minute. Either way, it needs to get taken care of and looked at. So Aiden is worried about the pain as wrestling season is coming up soon. So let's understand our patient a little bit better. So what questions should we ask them? What pertinent information will help us get a working differential diagnosis? And how should we approach this type of case? So some of the questions that might often be asked by the physician, kind of taking a look at, so you can kind of get an idea of what's going on, is a pain rating on a visual analog scale. When did the pain first start? What does the pain feel like? So is it sharp? Is it dull? Is it burning sensation? Where is it located? They'll have you kind of specifically point to it. Does any position make it feel better or worse? How long does the pain last? Is there anything that alleviates the pain? Does the pain radiate anywhere? Meaning, does it travel anywhere down the legs? Is it kind of going up the back? Is it going to the sides, the hip, or the stomach? And have you taken anything for the pain? And if so, does it help? So kind of what we found out during the history was the pain at the midline of the lower back near the L1, L2 vertebra, so kind of just localized in the area. We don't know what's going on yet. The intensity of the pain is a constant 7 out of 10 and becomes a 9 out of 10 upon extension. So 1 being nothing, 10 being the worst pain you've ever had. So it's pretty up there when he kind of moves into extension. What is the quality? So the quality is a sharp and has a burning sensation. So something with sharp and burning tends to be associated with something like a fracture usually, unless it's more neurological. So the onset of the pain first began 2 months ago during football training camp. So this was a time strenuous activity when he was being kind of pushed a lot, having 2-a-day activities. They're trying to get the athletes into the season shape is what they kind of, try to get them into. The pain does not radiate. Nothing really alleviates it. Aggravating is kind of spinal extension and some flexion, and he has not had any associated manifestations other than not able to sleep well through the night. So kind of some social and past medical history. So he's not taking any medications. He hasn't had any surgery. The patient states no previous traumas other than the common sports overuse injuries. So something that most athletes will do is kind of omit some of the past injuries they've had as they don't think it's pertinent to the specific case. So when you do go to your practitioner, mention everything from, let's say, you kind of had a pain in your lower back, you had a slight dislocation of a finger, whatever it is, just kind of, it may be pertinent to the case, it may be not, but make sure you do mention it when you go to your practitioner.